Wildfire season has arrived and smoke from several fires, including the Bear Gulch fire near Lake Cushman. It's been intermittently drifting into our region. So what exactly does that smoke do to our bodies, and how can we protect ourselves? And joining me to break it all down is pulmonologist Dr. Priyanka Makar from Optum Care Washington. Thank you so much for being here.
Thank you for having me.
Yes, so such an important topic. So why exactly is wildfire smoke? What is it exactly, and how does it affect our bodies?
Great question. So wildfire smoke is made up of two big things that are harmful for us. Harmful gases such as carbon monoxide, carbon dioxide, and most importantly, these fine particles which make their way into our lungs, causing sometimes temporary, sometimes permanent damage.
Wow, and who's most at risk when the wildfire smoke is filling our air?
So anyone can be affected by the wildfire smoke, especially if your exposure is long enough. However, the most at-risk groups are those with chronic lung diseases such as asthma, COPD, emphysema, patients or people that have chronic heart diseases, chronic kidney disease, diabetes, and we have to bear in mind our pregnant women and children are also at high risk from effects of wildfire smoke.
So what should some of those people that you mentioned, people with asthma, heart disease, chronic conditions do to really prepare themselves before they might have to go out and, get some of this smoke exposure, or they just can't avoid it?
Yeah, great question. So importantly, you prepare yourself, you protect yourself, and you plan ahead. So by preparing, I mean talking to your doctors, your healthcare providers, have a plan in place should you have a flare-up of your chronic lung condition with exposure from wildlife smoke. If you can, you really should stay indoors, maybe invest in like an air filter, which can be used to clean the air indoors. Make sure you stock up on your medications. And if you must go outside, make sure you wear a well-fitted N95 mask that fits over your nose and under your chin, so you can minimize the pollutants that you're breathing in.
Yeah, so definitely try not to be outside though as much as possible.
Absolutely.
Even in your house, are you supposed to be kind of like closing your windows too?
Great point. So you keep, if you can, especially if you have an air purifier at home, seal the windows, the doors, so you try to keep your air indoors as clean as possible.
Yeah, are there any other tips that you have for protecting us inside, outside that you feel like we should mention?
Yeah, so I think outside the key is stay away from the outside if you can. Wear an N95. Indoor, the one other thing that people can do is if you stock up on no-cook foods, that would be great, because if you are not using gas or fire indoors, you're minimizing the excess or the addition of air pollution inside. So that's another kind of pro tip, so to speak.
That is. And let's talk about kids too. So how old should a child be wearing a respirator, and how should parents know about choosing the right kind?
Excellent question. This came up so much during the pandemic,
I
right?
bet.
Kids should be at least 2 years or older before they start using a respirator or a mask. Biggest thing is make sure you are looking at the package instructions, because most of the time these masks are not meant for little children. And the last thing you want to do is have like a false sense of safety, right? So if the mask is not fitting well, the child is uncomfortable, the intended purpose of the mask is not going to be met. So you want to make sure that the child is very comfortable. Again, the mask should really fit above their nose, underneath their chin, not cover their eye, so that they can protect themselves.
Definitely. What are the signs or symptoms too that signal it's time to seek medical help?
Great question. So it can start off very minimally with like allergic type symptoms. So you're coughing, you have a burning eye, runny nose. Things that are more concerning are chest tightness, feeling of pain in the chest. Patients who are dealing with chronic lung conditions know that if they are wheezing and that doesn't improve with just some at-home treatments, that's a good time to get medical help.
Gosh, okay. And finally, what are some key tips that you want people to know about staying safe before, during, and even obviously when a wildfire is happening?
Yeah. So I'll mention this again, you prepare, you protect, and you plan ahead. So you prepare by stocking up on these no-cook foods, medications so you don't have to go outside your home and try to get supplies. Talk to your healthcare provider so you have a plan in place, especially for our patients with chronic lung diseases, because there are some steps we can do at home before they have to seek additional medical help. If you can afford to, get an air purifier for your home so you can keep your windows, doors shut and keep your indoor, air clean. If you are in an area like we are with excess, like wildfire, you have strategies in place about where to exit should you not feel well or the conditions continue to worsen.
Thank you so much for being here.
Welcome.
So important. And to learn more about services offered through Optum Care Washington, please just visit the website that you see on your screen. New Day Northwest is sponsored by Optum Care Washington.